Welcome to the Visibility Gap. I'm Dr. Jen Ashton. Today we're diving into a critical and urgent conversation, maternal mortality. Did you know that Black women in the United States are 2.5 to 3 times more likely to die from pregnancy-related causes than white women, and 3 times more likely to die than Hispanic women? These statistics, reported by the Commonwealth Fund, underscore a devastating reality. According to the CDC, disparities in maternal mortality are driven by a combination of complex factors, including differences in healthcare quality, chronic health conditions, structural racism, and implicit bias. These barriers disproportionately impact Black women. This is what the Visibility Gap is all about, shining a light on inequities that demand urgent attention. In this episode, we'll unpack the systemic issues fueling these disparities, explore how implicit biases and healthcare barriers perpetuate the issue, and discuss actionable steps to close this deadly gap. It's a tough but essential conversation about lives at risk and the fight for change. We'll talk to some experts to help us see the big picture and discuss what companies can do to help address the challenges. But first, joining us today is someone with a deeply personal connection to this issue. It's my privilege to welcome Charity Watkins. Charity, thank you so much for coming to share your story about your pregnancy and your experience.
First, I want to say thank you so much for addressing this very important topic. So before I became pregnant, I was a doctoral student working on my PhD in social work. I was active. I exercised pretty regularly. I was healthy. I had no health concerns. The most that I had experienced was getting my wisdom teeth extracted. Pregnancy was something I truly looked forward to, and I approached it much like I did my PhD.
And we should just mention for people who aren't familiar, to get a PhD in social work takes how many years?
Ooh, it depends. So I would say 5 to 7 years, potentially.
It's longer in many times, in many cases, to get a PhD than to get an MD. So that is really impressive. But just again, to summarize, higher education.
Yes.
You had a job. Mm-hmm. You had health care. You were motivated. You were informed. Yes. All of this going into your pregnancy.
Yes, and also at that point had been married for 2 years before I found out I was pregnant. And my husband was a microbiologist and had his PhD. And so we were a family of 2 with PhDs. Right. And, you know, that's a rare occasion. And what I thought would be something that would be a positive factor for me.
And you were how old when you
I was 30 when I had my daughter.
Okay, 30 and healthy when you delivered.
Yes.
Then when did things change? When did your experience with pregnancy kind of take a turn?
No major concerns until it was time to deliver. And my daughter, who the joy of my life, was very, very comfortable. She did not want to leave. She actually arrived 10 days after her due date.
Okay.
And it was an eviction notice, I would have to say. She had to be evicted. And I had to go through, unfortunately, an unplanned cesarean delivery. I had spent about 2 to 3 days in the hospital trying to do natural birth, and it just wasn't progressing. And so they told me that in order to avoid any complications, that we would have to do a cesarean.
So as you probably know now, or hopefully this was explained to you at the time, from 41 to 42 weeks of gestation of pregnancy, the risks to the fetus and to the mom really sharply increase, which is why usually antenatal testing of the fetus and the mom really picks up if a woman goes significantly after her due date. So were you having additional ultrasounds and blood tests and blood pressure checks?
Not that I can remember. No, I don't remember any additional tests. It was actually not determined until I had been admitted for my for her to be delivered that I was told that I need a cesarean delivery. So there was no conversation about me needing it it before, maybe 2 hours before it actually happened.
So you were asked to come to the hospital for an induction.
Yes.
And what transpired between when you checked into the hospital to the C-section?
I mean, we went through almost every single intervention possible to induce before getting to the point of doing a cesarean.
So they said, you're not dilating, she's not descending. We've tried, it's a failed induction, which is the OB term. So we're going to recommend delivery by a C-section. And then what was it like when you first held her in your arms?
So my husband and I would tell the story to her about the sound that came out of him, because he was actually the first one to see her versus me. And so here I was, this big blue cloth blocking me. So I had no idea what was going on. I felt pressure, but that was it. And when he saw her face and heard her cry, he just said, ah. Like this noise just came out of him just innately. And then I just remember crying because, you know, we had went through so much to have her. We weren't sure how we were going to get through this pregnancy as two young adults starting our lives together, but we were just overjoyed. She was going to be the first grandchild on his side of the family and first great-grandchild. And so she was the start of a new generation. And to see her little face when I first delivered her was just the best gift ever.
Incredible. I just got chills. And then what happened in terms of your postpartum course? Because that was for you where things really started to change. Yeah,
before I even left the hospital, things began to change. So I remember at least, I think maybe 24 hours after my cesareans, and I actually want to say it's a surgery.
It's a major, major surgery.
Major surgery through, some major muscles.
Incision.
Exactly. Yep. I was encouraged to walk around my hospital room. And so I did that. I was one who was going to listen to what the doctors recommended and follow through on those terms. And so I began walking around my hospital room. And there was one moment when I was sitting in the chair for a period of time talking to family members who were visiting. And I got up and I literally still now to this day hear the sound of blood hitting that tile floor. Just blood just rushed out of me as soon as I stood up. And here was my husband who was scared to see something like that happen. And then my sister-in-law was there holding my daughter.
And this was the first day after?
Yes.
And it was not, just to clarify, it was not coming from your incision.
No.
It was vaginal.
Right. Okay. And so my husband went to go find a doctor. And I laid in bed and just to prepare for what I don't know what was going to happen. And so as my sister-in-law was holding my 1-day-old daughter and looking out the window just to try to give me some privacy, my husband was holding my hand. A doctor came in, didn't really provide much explanation of what was going on other than I had clots. And he physically, manually removed the clots while I was in my hospital bed with no medication, no pain relief or anything, just manually removed.
Reached up into your uterus.
Twice. And the pain was extraordinary. The pain was something I would never want to wish on anyone. And I remember the scream that I let out. And my dad, who was waiting in the waiting area outside, actually heard me scream. And that was his introduction to his granddaughter, was hearing me scream. And it was just like the doctor came in and then he was gone.
Was a nurse in the room with you?
No.
Okay. So that sounds incredibly traumatic.
It was.
What happened after that?
Well, continued my stay in the hospital for, I think, 2 additional days. I was discharged and we went home with my daughter. And overall, I was feeling okay. I, of course, had to prepare myself for recovery from a major surgery while also preparing myself for entering motherhood.
And how much did the experience you had just in the hospital affect your feelings about pregnancy, possibly future pregnancies, and particularly in the experiences that you share with your friends and family?
Oh, I did not want to think about going back to the hospital for any reason, and whether it was having a child or not. I wanted to avoid the hospital after that because it was a scary place for me. Yes, I was able to walk out of the hospital, which I would have to admit that many pregnant people are not able to do. But I had the experience of hearing that sound that has stuck with me for over 8 years now. I still have the experience of having someone manually remove clots from my uterus with no pain medication, and that still being a memory in my head. And so these things haven't changed.
And how much was it affected by communication or lack thereof in the way it made you feel?
Oh, I felt dehumanized. I felt as if I wasn't dehumanized. I didn't feel like I was really there. It almost felt like I was watching from above what was happening, because how I was handled didn't feel like a human being who had feelings, who had the capacity to experience pain, who had any need for explanation of what was going on and what kind of care I would need afterwards.
Before or after?
Nope. I wasn't even told what my aftercare would look like.
So feelings of loneliness, isolation.
Yes.
Being invisible or not seen.
Right.
Based on what you know now from personal experience and just in terms of reading and your overall education and awareness, how much of a role do you think your race played in your experience?
See, that is a part of the experience of being a person, a Black person specifically for me in America, is that you are left with the questions of whether this had something to do with my race or not. I don't know, because I don't know what the counter story would be. I do wonder if I was a white woman, for instance, maybe they would have taken the time to explain to me what was going on. Maybe I would have been provided more care and compassion through that experience. Maybe my family would have even been communicated with about what was going on with me. But those are all questions I am stuck with. And, another piece of the burden of being a person who experiences racism.
Had you ever had any experience that made you question whether your race was a role before, even professionally, academically?
Oh, yes. Definitely. I am an outspoken young Black woman in a field that is dedicated to justice. I definitely have had those experiences myself within my educational experience outside of that. And I was aware of what racial bias looked like. I was also aware of what institutional and structural racism were. And I also had an idea of how to combat them and also advocate for myself. I just didn't think that I was going to need to do that while also giving birth to my first child.
Right. Have you ever had a healthcare or medical encounter that was positive?
I have. I would say that my relationship with my cardiologist has been very positive. She actually was the cardiologist who helped me in the hospital and provided me with care. And I had an opportunity to choose my provider moving forward after I was diagnosed. And I said, I want her. I want Dr. Chang. And she has been amazing. She communicates with me. She takes the time to explain to me what my diagnosis is, what kind of symptoms I should or shouldn't be experiencing. She explains what medications I'm taking and what they do. She asks me questions about my life. She cares about my child. She asks about how she's doing in school. And she is just absolutely amazing. I take pictures with her, like just to, signify, hey, we're now 8 years into this and I'm doing a lot better because of the care that you have provided me and the tools that you have offered me as a patient who is engaged in her care.
And how's your health today?
A lot better. Definitely a lot better. So when I was initially diagnosed, my heart function was around 5 to 10%. And I was very close to not surviving. And now I'm able to have, my heart function is around 45 to 50%, which is just on the lower end of normal. I'm able to exercise 4 to 5 times a week. I do cardio and strength training. I feel good.
Good.
I'm able to keep up with my daughter, which is one of the most important indicators for me of my health. And I feel good about life. I feel optimistic, and I feel that I have the capacity to help others from either not experiencing what I did or to have even better outcomes than me.
That's incredible. What would you say to someone who's going through pregnancy or postpartum feeling invisible, or that they're not getting the support or attention that they need, whether it's from their healthcare system, their work environment, their family circle? What's your advice?
Oh, stand in your purpose and recognize that you are here and you have the capacity to change how people view you, whether they have a choice, like whether they want to or not. I learned to speak up for myself, no matter how much I felt that I was on the lower end of knowing what to do. I am not an MD.
Was that hard?
It was. It was something I had to practice over and over again. And sometimes you make mistakes. You might trip up with what you're saying. You may not ask the question that you really had in mind at the moment that you have the opportunity to ask it, but you still move forward with it. You still say, hey, I am not sure what that means. Can you ask me, or can you explain that to me a little bit more detail? Sometimes it takes humility in order to do that. Other times it takes the humility of others to provide you with the space to do that. I just think that when it becomes a question of life or death, that we have an onus to do all we can to ensure we get the care that we need.
I mean, I just want to emphasize, you have a PhD.
Yes. Yes.
So for you to feel trepidation, uneasiness, self-conscious, whatever, any of those things in asking more questions or advocating for yourself is truly the epitome of how anyone can have those feelings.
Yes.
It is not a reflection on how smart you are, how many initials are after your name. It can happen to anyone. Thank you so much for sharing your story. I know that you quite literally could have saved lives by relating your experience as a woman in pregnancy and as a mom and as a doctor of social work. So I really appreciate that. I'm very grateful to have had this chance to talk to you, Dr. Charity Watkins. Thank you.
Thank you.
And to help us process Dr. Charity Watkins' story and give us the big picture to explore what companies can do to address this urgent visibility gap, I'm happy to say I'm joined now by two highly accomplished experts. Dr. Margaret Rutherford is a clinical psychologist with over 30 years of experience specializing in treating individuals and couples for depression, anxiety, as well as relationship issues. She's the author of Perfectly Hidden Depression: How to Break Free from the Perfectionism That Masks Your Depression. And Dr. Deirdre Cooper Owens is a historian, award-winning author of Medical Bondage: Race, Gender, and the Origins of American Gynecology. And she's a professor of history at the University of Connecticut. Dr. Cooper Owens' groundbreaking work has shed light on the intersections of slavery, race, and reproductive medicine, offering crucial insights into how history shapes our present-day healthcare systems. Welcome to you both. I'm so happy to be having this conversation with you. What was your reaction to hearing Dr. Watkins' story?
Yeah, I was not shocked. Unfortunately, I've been doing reproductive justice work since 2010, and it's not shocking, but it's still jarring because it's so traumatic. And to see her, this accomplished, beautiful young woman, and know that that is a part of her birth story. It was unsettling and sad. Resiliency, I always say, is born out of people's trauma. And so although she's resilient, and is raising this beautiful 8-year-old daughter. But there was something still so sad about that experience that it had to happen, in this nation.
Sadly, her story is not unique.
Yeah.
Dr. Cooper Owens, you know this
Yeah.
data better than anyone. Black women, as you know,
Yeah.
have a 3-fold increased risk of dying
Yeah.
during or after pregnancy
That's right.
compared to white women. Asian American women have the lowest risk.
Mm-hmm.
Hispanic women are at about a 2.5 time increased mortality risk. It is a complicated, complex problem. What do you think the biggest contributing factors are?
When you look at Black women, unlike any of the other groups that you named, and I'd also probably include Native or Indigenous women and birthing people, what you find is the markers of success that typically act as protectors, whether one is partnered or married, whether one is educated or economic standing, if you're middle class, all of those markers of kind of respectability that also protects the patient or the expectant mother, they don't matter when it comes to Black women. So the CDC discovered a few years ago that the person who is most at risk in this country for pregnancy complications or even, dying after giving birth, Black women who hold PhDs.
Do you think it would be different if patients were matched to their healthcare provider based on race?
The stats say yes, because the infant mortality, maternal mortality, and morbidity rates are decreased by over 50%. Rachel Hardiman did a study of almost 2 million hospital records in Florida from 1992 to 2015. She's at the University of Minnesota School of Public Health. And she found that when there were practitioners and specialists who were African American, those stats were decreased by over 50%. But we live in a nation where that shouldn't have to happen, right? That the laws should protect us all. And so in no way do I want to be the person to say, let's go back to Jim Crow segregationist era medical practices.
Well, in medicine, I say, I'm a board certified OBGYN. To be a compassionate oncologist, you don't have to have had cancer yourself. Right. So you're right. We shouldn't have to take those kind of things into account. But it is interesting when you look at the data and you look at outcomes. I think that's, there's subjective, there's objective, and then there's outcomes. I don't have to tell either of you the pathetic world ranking that the United States holds in terms of maternal mortality. 80% of the deaths during and after pregnancy are considered to be largely preventable.
Yep.
So we can make an impact on this, possibly even in this conversation, by increasing awareness. I want to talk about, because it's the name of the podcast, visibility. You are a pregnant person, maybe a pregnant woman of color. How do you, what would your advice be, Margaret, in terms of just navigating that period of time in a stressful, demanding environment, whether that's workplace, work outside the home, within the home, domestically, socially, financially, you name it, in a way that can help that person feel more seen, more confident, more empowered?
I think this is advice that I hand out to a lot of people who are going to doctors, is that I know I go to a doctor and I forget half of what I had thought about that I needed to say. And I think mentally and emotionally, it's often very, very triggering to go to a doctor's office. I mean, it may be that the medical profession, the more assertive you are, that it is taken as an affront and as a challenge.
Yeah, I often tell people when I'm giving talks or just consulting with folks to ask for a patient navigator or doula. And so oftentimes people are like, what do they do? I'm like, they advocate. Like, that's the most important, because a lot of people feel really intimidated because it's already an unequal situation, right? So you're like, doctor, nurse, and then they're like, hey, Rebecca, right? Hey, Shaniqua, so there's already that kind of imbalance. And so to be able to have someone who can advocate for you, but also when you're more at your most fragile state, right? I mean, you want to concentrate on growing this life inside of you in the best possible way. So number one, it's patient advocates or doulas. Number two, I would say come with, just as Margaret said, a list of questions. Use the internet. It's free, right? You can ask, what questions should I ask? Just put it in keyword search. That's the other thing. Nowadays, too, there are lots of apps that can help you data track that people can go to. There's an Earth app, all of those kinds of things.
I want to ask both of you about something that got my attention. The World Health Organization, actually, to address the maternal mortality crisis, and we may be doing among the worst in the world, but sadly, a lot of countries are not doing well. They recommend 4 health contacts. Doesn't have to be an in-person visit, but a health contact, they call it, in the first 6 weeks of the postpartum period.
Oh, I think that's a great idea.
40% of American women skip their one postpartum visit, which is why in the United States there's this big push for the so-called 4th trimester, which I loved that term.
Yeah, I like that term.
It's the period of time after a woman actually gives birth, where traditionally and historically, I would love to hear your viewpoint on this, the whole healthcare system unplugs from that woman. It's like, you've done your job, you've incubated a new human, now all of our attention will focus on that baby, and you just go back to, the way things were before you were pregnant.
Except nothing's the way
that's
it was
right.
before.
And so that 4th trimester is an opportune time for information, for encounters with any kind of healthcare nurse practitioner, midwife, obstetrician, family medicine, physician. What's your advice for the woman? Because it has to start with us. Right? We can't rely, we're in critical condition. We can't wait for someone to fix this for us, even though I know we're trying.
Yeah.
What's your advice, both of you, to the woman to say, okay, I know about the 4th trimester now. How do I be a better new mom and person in that 4th trimester for myself?
Wow. So I think the personal is political. I grew up in a very small town in a poor county in South Carolina that did not have a maternity ward since 1990. And that's when I graduated high school. And so what I would say for people who live in that situation, there's no public transportation system, those kinds of things. Make sure you have a network of support. Because doulas and midwives just don't exist in those places.
That's right.
You can't just jump on the bus or the subway. So you want to make sure that your friends and family are there to support you.
The problem is that we still don't understand postpartum depression and how prevalent it is.
Right.
It is the shame and the confusion and the just utter, I mean, they're disgusted with themselves that they don't feel this bond that they're supposed to feel, and that
the stigma associated
it's so
with it.
lonely. It's often a secret that they feel that way. And so I really think that trying to spread the word about just how common it's on a spectrum, just like everything else.
Yeah.
Obviously now, as you said, it's a spectrum. Perinatal mood disorders is now the term, because it's been recognized that it's not just depression, but also postpartum anxiety.
Yes.
And a lot of women who experience that after delivery in the postpartum period also had antenatal, during their pregnancy, mood disorders that oftentimes went unrecognized, underdiagnosed, undertreated, or undermanaged, which of course is another huge problem.
Exactly.
But the biggest myth that I have heard in my 20 years as an OBGYN, which absolutely drives me right up the wall, is when people say to a woman who clearly has a mood disorder surrounding pregnancy, "You're just tired."
Yeah.
Oh,
You know what? I don't know. The woman will say, "Do you think I could have postpartum depression?" And a lot of times the answer is, "I feel like you're just tired."
It takes a while to become
and
a mom.
and I cannot emphasize this enough, and you know this as a mental health professional, you know this as a historian, particularly in reproductive medicine. It can be life-threatening. This is not fluff. This isn't, something that's just going to miraculously improve if a woman takes a nap. So, and there are economic consequences to this, right? I mean, put into words what you think the actual financial toll, because we've talked about societal toll, cultural, racial and ethnic, economic and financial toll of this maternal mortality issue is significant.
It's hugely significant. I mean, so it's so complicated. It's so nuanced. The amount of money that is being poured into the reproductive medicine field is just astronomical. And then you think about the negative medical outcomes. And so I'm like, something has to give here, right? The number of C-sections that are often scheduled, and not for the benefit of the person giving birth. And yet, as you said, the United States remains the most dangerous place for women, and particularly women of color to give birth.
The United States, as you know, is the only country that does not federally mandate paid leave.
That's right.
Really?
Yes.
Wow.
Federally mandate.
That's right.
There are some states that have started to do it, but as a country, we are the only country.
That's right.
Let that sink in.
Yeah.
And Dr. Cooper Owens, how important do you think the male voice is in solving this issue?
I think it is important. I don't think we need to be siloed off. But what I do think is important is to have a male voice that is willing to listen and not necessarily be amplified in the ways that it has been amplified in the past. And so to also be willing to work in concert with women and communities. There's something that doulas that I've worked with, they talk about full spectrum doula care. And so that's at the moment that someone finds out they're pregnant to that kind of post care that you referenced before. And so to know that as a man involved in this field, that it has to be collaborative, that the large complaint that I've heard from women across the board is that people just don't listen to our voices. And so, to be able to be a part of a project like the Visibility Gap, it really is about erasing the invisible, right? And bringing to the forefront something that is visible. And so one of the wonderful things that social media has done is you can now find a lot about maternal care.
Yeah.
You can find a lot about reproductive rights, reproductive justice, and you can learn from vetted sources, And so I think that is also important. But I just think men need to listen to what their patients are telling them. And to also be empathetic, to imagine yourself in the place of someone who is, as you said, frightened. This might be the first pregnancy or the first successful pregnancy and what that means after someone has experienced such loss. And so I just think listening, being empathetic, being willing to collaborate are important.
I'm going to ask you both a question that I like to ask our experts at the end. I would like you to imagine that you are single-handedly in charge, responsible for fixing this whole situation, and to start with the actual woman who may be listening to you. What would your number one piece of advice be?
I would have birthing centers plural, in every state, in every territory that works in concert with OBGYNs, lactation specialists, pediatricians, midwives, doulas. I mean, they would all be in community for the successful care of that woman and or pregnant person.
Let's do it.
And I'll make an addition to that model.
Yes, yes.
Let's throw in social workers and psychologists and LPCs in that birthing center. My answer, what I said before you said that, was put a mental health professional in every OBGYN's office.
It's true.
60%, as you both know, 60% of the rural counties in the United States do not have hospital obstetric services.
That's right.
60%.
Yeah.
Communication can be improved on everyone 360 degrees, from the healthcare professional to the patient support system, to the hospital staff, to the workplace. Communication, education, awareness, starting from a place of no stigma. Let's add a lot of resources that have been shown to be effective and provide some benefit. That fourth trimester, I think, is critically important. Connecting mental and physical health is important, but we have to start to really prioritize women's health in this country for the benefit of not only the women, but our entire society, our economy, our culture.
And the children who are left without a mother.
Right. Yeah. Absolutely. Such an important, we could literally talk about this for hours, but I think that your tips, your insights, your perspective, your expertise has been incredibly helpful. So thank you both so much for spending some time. And thank you to our listeners. We really hope this episode of The Visibility Gap has helped you and your loved ones feel seen and empowered. If you found it valuable, please don't forget to share it, like it, and subscribe to stay connected with us.